Hello, hello. What's up, beautiful people? Happy Wellness Wednesday. Yes, yes, yes. You already know. As you all are coming in, I need those affirmations. So we're gonna start this live off with positivity. We're gonna start this live off with some good vibes, good energy. So I need your affirmations. I need even some goals that you have reached. Within these past couple of weeks, 4 weeks. Let me know, what are you working on? What have you accomplished so far? How do you feel? Good stuff. We want to talk about the good stuff. So that's how I'm gonna start my lives off when I do the nightly lives. The first 3 minutes of you all coming in, tagging your people, tagging your friends. Let me know something good in the comments. But if you do not know who I am by now, shame on you. But I am Coach Alicia, and I will be leading our Wellness Wednesdays. And tonight, I'm super excited about tonight's topic. It's something a little different, but I'm super excited to learn more about it. And also, if you are interested, and if you're in that, a certain profession, and you want to talk about that thing that you are an expert in as it relates to wellness, let me know. I made a post of a couple weeks ago now. I made a post a couple weeks ago, just pretty much letting you know about Wellness Wednesdays. And some of you, I was like, oh, what topics do you want to hear? So some people just put the topics. But if you are a professional in that profession, I would love to have you, love to interview you so we can all learn more and more and more so we can continue to build our knowledge about how to stay healthy and then, just being consistent with our wellness journey. But I'm going to allow a few more minutes for you to come in. I'm super excited about like all of the posts that I've been seeing. Look, the progress has been made. And for those of you who have not posted yet and you're like, oh, I'm just a silent, I'm just in here. Like you're doing the work, but you haven't posted yet. I want to encourage you, post. When you post and share your story and share your goals, you really feel good about yourself. Like I'm here to tell you because you're gonna get that love, and sometimes you motivate people, other people. Like sometimes people need to hear your story. You never know how your story can help motivate other people. So if you know, like, okay, well, uh, let me go ahead and share, even if it's just a little flex, like, man, I haven't posted yet. This is my first post. Maybe you will encourage other people to finally post, but we want to see your face. We want to see your accomplishments. We want to celebrate you. So don't be shy. Don't be shy. Go ahead and post. We're here to support you. But we'll probably have like 15 more seconds. So again, continue to tag your friends, continue to put these positive affirmations or just all these goals that you guys have been reaching, put them in the comments so we can celebrate you as well. But yeah, so we're gonna go ahead and get started. And again, I am super excited about tonight's topic because it's different. It's different. We're talking about sleep tonight. Like it's almost time to go to bed. And we're talking about sleep and sleep health. And we know that sleep is essential for our physical and mental health. What a lot of people don't even realize sometimes, you're like, man, I'm eating right, I'm exercising right, and all these things. And then we ask you, like, okay, well, how's your sleep? Oh, I don't really get too much sleep. Baby, that affects you. That affects you. So I want you to know that does affect your progress. So don't just be like, oh, I got 2 hours here. No, but we make sure you're getting your sleep, okay? So this is why we have Dr. Subna to talk about sleep. Hello, hello.
Hello, good evening.
Yeah, so tell the people who you are and a little bit about what you do, and then we're going to get into some questions that I have for you for tonight.
Awesome. Thanks for the introduction. So I'm Dr. Supna Amin McCann. That's what I go through on Facebook. I am a dentist, but I also treat a lot of patients for sleep apnea, obstructive sleep apnea. And I'm going to talk a little bit about that tonight. So I know you're kind of thinking, oh, a dentist, but we do a lot of head and neck anatomy. And we're seeing a lot of signs and symptoms in the mouth that show us that someone could be possibly struggling with sleep issues. And then we just talk into a conversation about it. And sure enough, we find out there's a lot tied into that. So
Wow.
I've been with E2M for almost 3 years now. I joined in, the holiday round about 3 years ago. So that was a hard round to join in. But I love it. I've always loved wellness, fitness, health. Also, a lot of it about what I do as a profession is related to that as well. So I'm really excited to be here tonight and share my passion. I've been a dentist for about 16 years.
Oh, I am.
And I have an office here in Flower Mound, Texas, which is near Dallas-Fort Worth area.
I love it. You are already like I know you mentioned about sleep apnea, but you also said something about being able to look at the mouth to see how our sleep is. That's so interesting to me. So my first question is for those who do not know, what is sleep apnea?
Yeah, great question. So sleep apnea doesn't just mean you snore at night. It's not your grandpa or grandma snoring when they take a nap. Sleep apnea really is when there's episodes of something called hypopnea and apnea that are occurring at night. So basically, apnea means when you stop breathing fully, and
Mm.
hypopnea means when you have shallow breathing, less oxygen going to your cells, your brain for 10 seconds at a time in each hour. And a measurement that we use, or kind of an acronym in the dental sleep world, is called AHI. So apnea hypopnea index.
Mm.
So when we refer you out, or if we see signs and symptoms after we discuss with you what's going on, then we refer you to a medical doctor to get a sleep study done, and they get a report back to us. And if that AHI number is less than 5, then that's good. But anything over 5, there's mild, moderate, and severe. And that's when we're really concerned and we got to treat that.
Oh my goodness, that's interesting. Yeah, I have family members that have a sleep apnea machine, and I'm like, oh, that's because they snore. So you look, I'm learning too. I'm learning too. All
Yeah.
right, my second question is, what is your role with sleep dentistry?
Great question. So a lot of, normally when you think about going to the dentist, crowns, fillings, root canals, getting your teeth cleaned. But there are some significant things we see in the dental mouth when we're doing your dental exam. For example, if we see grinding and clenching happening in your mouth, it is not because you're just rubbing your teeth too much or your jaw's messed up or something like that. A lot of times what's happening is your brain is putting a signal to your bottom jaw to move it at night because it can't get airway. It's not getting oxygen. So it causes something called bruxism. So nocturnal bruxism is the fancy term of grinding and clenching. Another thing that we can see is anatomically we screen, and the American Academy or the American Dental Association requires all general dentists to be screening for sleep issues, sleep breathing disordered problems. So there's not just, obstructive sleep apnea. There's also something called upper airway resistance syndrome. And what I usually help patients with is screen them, give them awareness to it. Even with kids as well, pediatrics is a little bit different. And I also look at their anatomical structures. Are there things in there such as tongue tie, lip tie, narrowed palate, tons of crowding? All of that can really put you at a higher risk of having sleep apnea. And then I educate them. I educate them that, honestly, they say 65% of patients who have had a stroke usually have sleep disordered breathing issues. So that's scary, and I know a lot of times when I go to my MD, she's not looking in my mouth or she's not discussing really sleep apnea. I look fit, healthy, normal, but believe it or not, I have something called upper airway resistance syndrome. So that is a type of sleep disordered breathing issue where even your fit, healthy, young, or thin, slender females can have. And that basically means it takes me a lot of resistance to get my oxygen at night. I don't snore. I don't bother my husband with it. He doesn't hear it. But it does show that I have grinding signs in my mouth and that I wear special sleep appliance that I also make for patients. So if they can't tolerate the CPAP, which is what we highly recommend, you should always try a CPAP. But most of my patients that come to me, 50% of them are the ones who don't want to wear the CPAP anymore. It's annoying. It feels bulky. They don't like it. But they need oxygen. We all know how important oxygen is at night. So we help them as a dentist who does sleep dentistry, I make them a mandibular positioning appliance that brings their lower jaw a little forward. And it's customized to their bite and to make sure that their jaw doesn't get sore from it. And it allows more oxygen to happen at night. And also brings your tongue more forward so you have less chance of obstruction at night.
So, I have a dentist appointment next month. And I'm going to say, look, y'all need to let me know. Do I need something? What is my mouth telling you about my sleep?
It's
like,
important
now I'm like, I feel like I need to get screened.
Yeah, especially if you have a history of it. You could take Coach Alicia. There's it's called the Stop Bang Assessment. Okay. You could take that online, print it off, and if you show risk for it, there's a couple of questions and then you add it up. Hey, it's worth advocating for yourself.
Say that one more time. The Stop Bang. What was the last one?
Stop Bang Assessment. So
assessment.
bang
I
assessment.
got you. Listen. All right. I'm going to be. All right. So our third question is, what should E2M clients be concerned about? I'm sorry. Why should E2M clients be concerned about sleep disordered breathing problems? But you kind of told us just
Yeah, a
now.
little
But
bit
if you
about
want to
that.
elaborate on that.
Yeah, I mean, the biggest thing is a lot of it all ties into wellness and health, right?
Mm-hmm.
And one thing I've learned with E2M, this is not a quick fix program for 8 weeks, come in, lose weight. There
Right.
are all kinds of reasons we are all here, why we started, and why we stick around, right? And
Mm-hmm.
I love that you and the coaches and Coach Jeff all talk about wellness overall. And sleep is so key. Like you started off tonight's live, is you have to have sleep. If you're not having sleep, you're not getting that restorative time, the rejuvenation for your cells,
Mm-hmm.
you're going to see that plateau, or possibly weight is still creeping up and you're like, what is going on?
Yeah.
Or you don't have hereditary issues for high blood pressure, but all of a sudden you got high blood pressure now. Because at night, think about somebody's choking you at night because you can't get oxygen. So your body is constantly in stress. So cortisol increases, belly fat increases, something called C-reactive protein increases.
Mm-hmm.
That's all tied together. And so we all know with the mindful mental talks, we got to decrease stress levels, but we also have to, sometimes we don't have control over that overnight.
Mm-hmm.
And that's why it's important to get screened for sleep apnea and look for those signs and symptoms. And it's really, really related to cardiovascular health. You can't perform your best or be your best if your sleep is off as well. And
you are so right.
a
I'm
lot
an
of
8 hour
times,
girl over here, and when I do not get my 8 hours,
yeah, I wish I got 8 hours. I still strive. I'm scrolling on those posts too much.
girl, no, put that phone down, put that thing on do not disturb, and we are out.
Also, one other thing too, sleep is related a lot to anxiety, depression. I know mental health's a huge thing right now, and a lot of times, especially our fit females, they may not have that large neck circumference, but they may have something called upper airway resistance syndrome, like I mentioned before. And they could also be having some depression, anxiety, but it's because your sleep is disrupted. You know, your body's never in that REM cycle that it needs to be in. So it's important to get the non-REM sleep and the REM sleep and get enough of it each night.
I'm going to learn so much tonight. All right, I have another question for you. I have 2 more, if you don't mind.
Sure, no problem.
My next question is, how can you screen, well, you kind of said this, at home for possible sleep issues?
Yeah. One other thing too, you could download an app called Snore RX Lab. So Snore RX Lab. And it's a free app. It should be free still. A lot of my patients use it. Or, you could use your Apple Watch. You could use the Aura Ring. Those are just kind of quick ways to know how's your sleep score at night. Are you sleeping well? But one of the main things too, you're having a lot of daytime sleepiness through the day. You're drinking all this espressos and Nespresso, black coffee in the morning, but then are you needing to have caffeine like all through the day and you could still fall asleep and take a nap? Then there's probably something going on. Or is your bed partner complaining that you're snoring too much, possibly, or gasping for air, stop breathing, maybe a little restless leg syndrome, twitches, those kind of things can really make a difference in kind of knowing how you feel. Do you have that brain fog, even though you're sticking with clean diet, you're exercising, those sorts of things.
Interesting. Now I'm like, I have to tell my partner, like, watch me when I sleep. What I be doing? Put your hand up underneath my nose. See if I'm breathing. All right. I have one more question for you.
Sure.
And before I get into this question, I do want to say just thank you so much for this knowledge. I'm learning a lot. Like, I'm going to do this stop bang assessment.
Yeah.
You don't know what you don't know.
You don't know.
And these are things that I would have never even thought about by just even, like you said, looking at someone's mouth,
Yeah.
But I am, like I said, when I go to the dentist next month.
There you go.
I was like,
I like
hey, what's going on?
it. I like it. Yes.
Hopefully they know what they talk about. But we'll all right, my last question is, what are options to treat sleep apnea and sleep hygiene tips to help with our overall wellness?
Yeah. So first thing, either see a dentist who has training in sleep dentistry, because not all dentists do those certifications, but of course it's important to find someone who knows that.
Yeah.
Secondly, talk to your doctor, bring it up. You could even seek a sleep center that has, it's very specialized just in sleep. But if you're going through any of these symptoms or see any of these signs or have hereditary disposition to it, doesn't hurt to get screened for it, right? We always want to make sure that we're the healthiest version of ourselves each day.
Mm-hmm.
So take a look at that. Then usually, like in the dental office, we can send you home with a test, a sleep test that you can take home. We call that a home sleep test. And it's kind of like has a pulse ox on your finger, and it's like an iPhone watch that you wear. You wear it for 2 nights, no alcohol that night, try to be in your own bed, and it's important then to send that in. And then we get data, and it tells us all kinds of things. Your AHI score, which is that apnea hypopnea index, that's the number one thing. It also tells us how much heart rate went up or how low it went down. How many times you stopped breathing, even position. If you're right side, left side, back, tummy, kind of gives us an idea of what's happening when you're turning and tossing around. I know that chiropractors spoke about that pillow. I highly recommend that one too, Core Pillow. I use that as well. And then some sleep hygiene tips. So once you get the test back, then of course, talk to your doctor about, are you going to do a CPAP? There's surgical methods. There's also learning, most importantly, how to be breathing through your nose and not your mouth. So a lot of times just in the dental chair, I can tell my patients who are the gaggers, who have a hard time with x-rays, who can't have all the stuff in their mouth. They usually can't breathe very well through their nose, and nasal breathing is so key. That's how we're supposed to be breathing, not mouth breathing. And you can work with someone called a myofunctional therapist. They teach you how to breathe through your nose, where to put your tongue position, all kinds of things. It's fascinating and also a lot of information. And then if the CPAP doesn't work for you, that's always the gold standard to treat obstructive sleep apnea. Then you can consider a mandibular device that we make as dentists that's customized to your mouth. Don't get the ones over the counter because that can mess up your jaw and things like that. And then we follow up. We do another sleep study with the appliance in to make sure that we're seeing those numbers go down. And then for sleep hygiene, we always say, try to sleep at the same time, wake up at the same time. Have a routine. You guys talk about that all the time in E2M. Have those habits. Get exercise for at least 30 minutes a day. Get outside. Get that sunshine first thing in the morning. It helps make all your rhythms for the day, gets you reset, good nutrition, diet, exercise, no screen time an hour before you're going to go to bed. That's really important. Decreasing your stress levels. Make sure your room is kind of dark, cool. They say about 65 to 69 degrees temperature. You could think about white noise, and there's, plenty of other resources out there too.
Okay, I love it. So before we get up out of here, let people know again where they can contact you. I know you say you're located in the Texas area. For those who are near the Texas area, if you want to give that information so they can, come set up an appointment. But yes, let us know that information.
Yeah, so I'm in Flower Mound, Texas. It's called Flower Mound Family Dentistry, and I've been there now since 2010, so quite a while.
Okay.
And I just have to give a shout out to my mommy dentists in business, APs, and my beautiful babes, APs as well, because they've kept me through this. But yeah, talk to your dentist or talk to your medical doctor, or find, DM me if you need help of wherever you are over the country, and I'll try to help you find someone who can help you.
I love it. So, all right, guys, here you have it. Make sure you are taking notes. And I think it's important for all of us to go see, get an assessment done, because you don't know what you don't know. And if there's something out there that we can learn about ourselves so we can help be the best version of ourselves, why not? So again, guys, thank you so much for tuning in for another Wellness Wednesday. You already know what's happening tomorrow. We have Cardio Hit every Thursday at 8 o'clock p.m. So please make sure you set that alarm. And then you already know I'm going to see you Friday at 6 o'clock a.m. Eastern Standard Time. So go ahead and put that on the calendar as well. But again, guys, tap into next Wednesday. We have another special guest talking about a great topic. But until next time, God bless.
Bye.